So this model shows the very basics of the respiratory tree, which I can briefly go over. I'm going to focus more on the lung part. One more time with the respiratory tree. You start with the hyoid bone. This is from 2401. Hyoid bone is just where some of the musculature attaches. So when we swallow, we can elevate the larynx out of the way. Remember, the base of our tongue muscles attach here as well. So that's hyoid bone. This is thyroid cartilage. That is cricoid cartilage. This whole structure is the larynx. C is the trachea. And before I remove the lungs, we can actually go through the lobes of the lungs. So this is your left lung. Okay, notice that the apex of the heart sits more to the left. This is actually called the cardiac notch. So it makes this lung smaller. The left lung only has 2 lobes. This one up here is your superior lobe. This one right here is the inferior lobe. You can see there is a groove that runs between them. It runs at an angle. This is the oblique fissure. Okay, so the visceral pleura would be above this, and the visceral pleura invaginates into the fissures. Where the lung is attached to the diaphragm, that is the base. Up here, where it goes close to where your lymphatic trunks dump into, that is your apex. Okay, the left lung, we have 3 lobes. So E here, this is your, this is your superior lobe. It's very big. This is the middle lobe. And then very, very small here, you're seeing is the inferior lobe. Most of the inferior goes behind. Okay, it has 2 fissures. This is at an angle. This is your oblique fissure. And this is more straight horizontal, especially right here, so this is a horizontal fissure. Okay, if I actually remove the lungs and the heart, we can see some of the respiratory tree structures. So that's the carina. This would be your right primary bronchus. This is the left primary bronchus. Secondary would be, that's secondary, and that's secondary right there. This one looks weird. Okay, it's primary here. That is a secondary or lobar bronchi. That is a secondary or lobar, and this is a secondary or lobar. So this has, the right side will have 3 secondary or lobar bronchi, 1 going to each lobe. The left only has 2. So these 2 little Y splits, those would be tertiary or segmental. You can also see the main muscle of respiration here. This is your diaphragm.